Hello, my name is Captain Paul Link. I work with the Hospital Preparedness Program within the Office of the Assistant Secretary of Preparedness and Response in the Department of Health and Human Services of the United States. Today, we are going to be talking about the Region 4 Highly Infectious Disease Transport and Treatment Plan. Region 4 consists of Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. In this plan, it outlines the safe transport of patients with confirmed Ebola virus disease and possibly other types of infectious disease. This includes the communication and transportation protocols required for the rapid transport of these patients to a regional treatment facility. That regional treatment facility is at Emory University Hospital in Atlanta, Georgia. This plan applies to all 8 of these Region 4 states and all the facilities that may encounter a patient with this highly infectious disease. So what is the situation that we're facing? Ebola virus disease is a highly infectious disease. The symptoms from Ebola can appear anywhere from 2 to 21 days after exposure and include fever, headache, joint and muscle aches, weakness, diarrhea, vomiting, stomach pain, and abnormal bleeding. It is transmitted through direct contact with blood and bodily fluids of infected symptomatic person or through exposure to contaminated objects like needles or fomites. The people that get this disease are not contagious until they develop the symptoms. So persons with the highest risk for Ebola virus disease include healthcare workers and family and friends of those infected patients. The first step of treatment is effective isolation of the patients and appropriate infection control measures. And that can control the spread of this disease. The details of this disease can be found at the link at the bottom of the screen. There are a couple things that need to be met prior to the implementation of this plan. First and foremost, Emory University Hospital needs to be open and available for care of patients. Another thing that needs to occur is the patient actually has to be confirmed by a recognized lab that they have Ebola virus disease. If it's not absolutely positive that the person has Ebola virus disease, there at least has to be a high suspicion for confirmation of the disease, and the 2 physicians from the different facilities have to agree that transport is necessary to Emory. Another decision that has to be made is whether they're going to go by air or ground ambulance transport. The preferred method to go is by air with the Phoenix Air Group, and that's done through the State Department of the United States. Lastly, there needs to be trained staff that are capable of transporting these patients from the facility to Emory University Hospital. So what do you need to do to implement this plan? The first steps are notifying and communicating with other individuals about the disease and the need for transport. To go over these steps, I'm going to transfer this presentation over to Jenny Raspberry, the Region 4 ASPR Regional Emergency Coordinator for the states of Georgia and Alabama.
So what are the notification and communication processes during an incident where we might have a person under investigation? So how are we going to communicate? What are the procedures between the community, the regional, and the state partners? Who contacts who? And who should be on each call? So these are some of the things that we're going to test during this exercise, and we will modify the plan according to the lessons learned. The notification process begins at the point of entry into the healthcare system. When a person under investigation presents and has a positive travel history as well as is symptomatic. So the Region 4 Ebola Transport and Treatment Plan includes checklists with all of these notifications and all of the calls that need to happen between all of our partners from the local, federal, and state levels. Initially, however, the call process begins when an originating hospital contacts the POC from an authorized public health and healthcare coordinating agency, which would be the initial facility. When we talk about transport, this will be the sending facility. So then the originating state and authorized public health and healthcare coordinating agency contacts the Georgia Department of Public Health with a request and a notification that they have a person under investigation. Georgia Department of Public Health is the primary contact because Emory University Hospital is in Georgia. So the Georgia Department of Public Health will be contacted if they have a 24-hour hotline number, and it's 866-PUB-HEALTH. 866-782-4584. So this initial method of communication will always be by telephone to that Georgia Department of Public Health 1-800 number. Subsequent communications, though, may be arranged between the affected state's authorized coordinating agency and the Georgia Department of Public Health during the initial contact. So they may decide to follow up using other modes of communication. We've broken this down into basically 3 phases. So we have the identification. So the first phase, identification, there's multiple steps that are going to take place during this phase. But you have to identify this person under investigation and start the communication process. And it's important to start the communication process early. The next phase is the confirmation phase. This is where samples will be sent to laboratories to confirm that the person under investigation actually does have an infectious disease, or that we have further evidence to support the high probability that the person under investigation does have a highly infectious disease. Additional notification and communication steps will be taken during this phase, which will be outlined in a checklist that's going to be included in the transportation plan. The next phase is the transportation. So many more additional phone calls and decisions will need to be made during this phase, which will include how are we going to transport? And we'll once again talk about that in a few more slides. Is air or ground the best mode of transportation? And a lot of different entities and partners will be on these calls during this phase as well. So in the Region 4 plan, we have several different tools to use to help make decisions during this type of scenario. This is one example of a decision tree that's included in the plan, and it's for notification to help you make decisions to who to notify and when and what part of the process. This is also an example of a checklist that's going to be included. It's just been updated, and it's going to be included in the new updated Region 4 plan. The notification process continues throughout the entire process of identification to transport and arrival of a person under investigation to a regional Ebola treatment facility. So as we saw on the previous slide, on the checklist was just one example of the many conference calls that take place during this communication and notification process. So this is an example of the checklist for the transportation decision call. It's only one step in the transportation process, but as you can see, the group call is only one of the many calls listed on the section of the checklist. The checklist is broken out by responsibility, so everyone from a Region 4 state can follow this process. So what is the process for moving a patient under investigation from an HHS Region 4 hospital to Emory? Who makes this decision? So the authority to implement this plan lies with the affected state's authorized public health coordinating agency in coordination with the Georgia Department of Public Health. The process also must include coordination with the Region 4 HHS Regional Emergency Coordinator and Emory University Hospital. Okay, so what factors do we need to consider with transporting a patient? Air versus ground transport, patient transport readiness, and the regional Ebola treatment facility readiness. Air transport is always going to be the preferred method of transport to the regional Ebola treatment facility and should be ruled out as an option before ground transport is considered. Air transport is coordinated local, state, and federal mission The federal government, through the U.S. Department of State, has sole source contract with Phoenix Air for transport of Ebola patients. The service is based out of Cartersville, Georgia. So the assumptions that need to be met for patient transport readiness are the EMS provider is ready within 4 hours of notification to transport the patient from the initiating hospital to the airport. The federally contracted aeromedical transport is available. The airports within the designated patient of origin and the receiving airports are ready to receive the aeromedical evacuation plane. And the receiving EMS provider is also ready within 4 hours to receive that patient from the receiving airport. So what are the assumptions for the regional Ebola treatment facility readiness? First, the treatment facility is available to accept patients from within HHS Region 4 within 8 hours of notification. Also, the treatment facility must maintain a bed capacity to treat at least 2 Ebola patients at one time. The treatment facility maintains a capability to treat pediatric Ebola patients or agrees to transfer or redirect pediatric patients to Emory University Hospital or Children's Hospital of Atlanta, Eggleston. The treatment facility maintains the capability to handle Ebola contaminated or other highly contaminated infectious waste. Next, the treatment facility must maintain a capability to address behavioral health needs for their patients and staff. And finally, the treatment facility maintains the capability to provide culturally and linguistically appropriate services during procedures and interventions. So, if these conditions are met, we have a decision tree in the plan for air transport. We also have an example of a decision tree for ground transport. There may be a situation where we need to transfer a patient out of Region 4 to another regional Ebola treatment facility. There are protocols in the Region 4 plan for this situation. The process will always include coordination with HHS Region 4 regional emergency coordinators. So we talk about making the decisions for air versus ground transport. What is the criteria for determining the most appropriate method for transportation, air or ground? From the time of request to the federal government, it takes approximately 2 hours for an aircraft to arrive at the requesting Region 4 state, pending availability of the aircraft. Availability of the aircraft is contingent upon weather and priority of competing mission assignments. Phoenix Air maintains a fleet of 3 modified Gulfstream G3 jets which have aeromedical biological containment systems installed. For more information on Phoenix Air and on this specific aircraft, you can follow the link. Patient medical records and information will be transported in hard copy with the patient. So there's 3 distinct components of air transport in the plan, and this illustrates this process. The first leg is from the assessment hospital to Airfield A, which is the airfield that has been designated closest to the assessment hospital. Then Airfield A to Airfield B. The next leg will be Airfield B to the regional Ebola treatment facility. If the decision is made that ground transportation will be the mode of transportation for a patient, in Region 4, we have patient transfer points that are predetermined for transferring patients from a state in Region 4 into Georgia. These patient transfer points are identified at locations within an acceptable transport distance to the regional Ebola treatment facility. At these patient transfer points, the Georgia Infectious Disease Transportation Network will take over patient care and transport for the final leg to the treatment facility. Additional patient transfer points within Georgia may be utilized if necessary for unseen situations. This slide shows the current Region 4 patient transfer points. During ground transportation, the state in which the patient presents is responsible for transporting the patient to the patient transfer point. It may be necessary in some cases to change crews at midpoint or multiple points during the transport to the patient transfer point. The originating state is responsible for identifying locations to change crews and refuel transport vehicles as necessary. It is strongly recommended that all ground transport vehicles be followed by a support vehicle that can assist with refueling, provide logistic support, provide relief staffing, and emergency support. In most cases, interstate ground transport will be multi-leg transport. This diagram depicts possible scenarios for 2, 3, and 4-leg ground transports. Let me turn this back over to Captain Link, who will talk about mitigating risks.
Thanks, Jenny, for explaining those communication and transfer processes. There's a few more things in the plan that we need to discuss, and those include the mitigating the risks and the big factors that are included with the transport of an Ebola patient. Those include waste contamination, the death of a patient in transport, and some other potential risks. So when we consider waste contamination, there are a lot of regulations that guide treatment and transport of these waste products. But what we really want to understand here is that each state and the treatment facilities have to have a waste management plan for Ebola contaminated waste in place prior to the plan occurring. Additionally, Ebola associated waste that has been appropriately incinerated, autoclaved, or otherwise inactivated is not infectious. It does not pose a health risk and is not considered to be a regulated medical waste or hazardous material under the federal law. Therefore, this waste no longer is considered a Category A infectious substance and is not subject to the requirements of the HMR. Ebola-associated waste may be incinerated. The products of incineration, for example, the ash, can be transported and disposed of in accordance with state and local regulations and standard protocols. So treatment of waste generated during a transport includes the following. Waste generated during the transport of the patients from an originating facility to a designated air transport location will be returned to the originating facility in that transport vehicle for disposal based on the facility or EMS provider's waste management plan. The waste generated during ground transport will be managed per the following protocols. That facility that has agreed to be the designated transfer point will dispose of the waste per their facility Ebola waste management plan. The waste will be disposed of at a final destination per the Emory University Hospital Ebola Waste Management Plan or by another Region 4 Ebola Treatment Center Waste Management Plan. The EMS units will doff PPE at either the transfer location or the final destination, and the EMS vehicle will be cleaned and disinfected at that site. What happens if a patient dies during transport? Although Ebola-related deaths in the United States would likely occur within a hospital setting, an incident of death during transport of an Ebola patient is a possibility. Ebola can be transmitted in post-mortem care settings through direct handling of human remains without proper precautions and use of PPE. However, should a patient die in transit, decisions as to where the remains will be transported will be handled on a case-by-case basis by the medical control, depending on transport time to the next facility, provider time in PPE, and the state or location that the ambulance is in. The assumptions that need to be met is that each state should have a plan to manage the remains of Ebola patients, and Ebola treatment facilities and assessment facilities must have a facility-specific plan to manage Ebola virus disease fatalities. Finally, there are some other considerations that we have to look at before we can go. The medical legal transport considerations. Any state in which a patient will be transported through shall be notified through the established notification process. Non-emergent status. Transport shall be treated as non-emergent transports with no lights or sirens. Certain responsibilities need to be maintained. During any leg of the transport, the state that has the primary responsibility for care and transport of the patient is also responsible for the logistical emergencies and will use their 24/7 coordination point for these emergencies. And support vehicles. It is highly recommended that the support vehicle be a second ambulance, including staff and appropriate PPE. Some medical treatment considerations include the Memorandum of Transfer and the Interfacility Orders Checklist. The Memorandum of Transfer will designate the receiving physician at the regional Ebola treatment facility who will provide online medical direction and should be immediately consulted in any deviation of the patient's condition. The sending and receiving physicians determine treatment protocols and provide written orders to the transporting EMS providers. The Memorandum of Transfer is signed by the sending physician and includes interfacility orders checklist. These checklists include such things as resuscitation status, invasive procedures that are allowed, direct numbers to 24/7 coordination points, and the direct number to online medical control. These documents need to be filled out prior to the transfer and maintained throughout the transfer. So on behalf of ASPR Region 4 and all of our partners, we want to thank you for attending this educational seminar and all you do every day.